Well, first we want to welcome everybody that's tuning in via Facebook Live. We have our radio stations here, and it'll also be on GovTV. How this is going to go is we're going to try to do these every day in the afternoon, about 3 p.m. each day, in accordance with the state media releases that Governor Noem is doing. And first I'm going to introduce Jennifer Bader with Prairie Lakes Healthcare, and she is going to be introducing everybody and starting our media briefing. Jennifer?
Thanks, Nick. So a collaborated effort between organizations really enhances safety preparedness. So representatives from vital city and county organizations came together for a unified process to inform the community of updates regarding coronavirus, otherwise known as COVID-19. So the current state changes rapidly, and this task force encourages our community to stay updated with reputable information through updates like this briefing. So first, we're going to have Mayor Sarah Karen come and give an update.
Thank you, Jennifer. I'm very pleased to announce that our community is responding to this pandemic in a very proactive manner. Even though we have no confirmed cases of COVID-19, we have established the Unified Command System and are carefully following the federal guidelines set forth by the Center for Disease Control. And this will enable us to manage an outbreak properly if we should develop one. Most people in our community are taking the proper steps and taking responsibility for staying home if they have symptoms of the illness, or taking care of the appropriate personal hygiene and housekeeping, limiting non-essential travel, and avoiding large groups of people. The supply chain is still working well in Watertown. Our stores are able to restock their shelves. The school district is working hard and is close to having a plan in place for education and meals. Our neighbors are asking how they can help and stepping up to provide for the needs of others. We can all be very proud of the outpouring of support for getting this right. Our goal is to have our community run as much as possible in a business as usual manner for as long as is practical, and to produce the best outcome for all. Thank you.
Thank you, Mayor Sarah Karen. Next, we will have Shannon Britt, who is an infection control nurse at Prairie Lakes Healthcare System.
What I'd like to talk to you about today is prevention. This applies not only for COVID-19, but also for prevention of all conditions and keeping ourselves healthy. We'd like to remind you to wash your hands often with soap and water. To wash your hands effectively and correctly is to wash for 20 seconds. That is the time it takes to sing happy birthday to yourself 2 times. Then rinse your hands with warm water, dry your hands with a towel, and shut off the faucet. If you're unable to have access to soap and water, alcohol-based hand sanitizer with at least 60% of alcohol you can use, but be sure to rub your hands until that is completely dry. Doing this for completely dry does not have the same effect for effective cleaning of your hands. You should wash your hands before eating, after going to the bathroom, and after blowing your nose, coughing, or sneezing, or use with tissue. For more additional information on hand washing, you can go to CDC for good hand washing guidelines, and it even shows you videos on proper hand washing techniques. I want to remind you to stay home if you're sick. We're encouraging also social distancing, avoid close contact with others. Limit your physical contact, including handshakes. Limit in-person meetings. If it's possible, make the phone call. It's easy to run into someone's office to ask a question quick, but at this time we're trying to limit the face-to-face contacts. Avoid crowds. Avoid touching your eyes, nose, and mouth. Cover your cough or sneeze with a tissue. After using the tissue, dispose of it, and then wash your hands with soap and water or the alcohol-based hand sanitizer. The best is to cough into the crook of your arm, or to sneeze there also. Regular household cleaning sprays or wipes can be used to clean and disinfect your frequently touched objects and surfaces. At At this time, they don't believe COVID is spread by contact with surfaces. As for face masks, both Centers for Disease Control, or is referred to as CDC, and the South Dakota Department of Health do not recommend that people who are well wear a face mask to protect themselves from any respiratory illnesses such as COVID-19. Face masks should be reserved for people that have showed symptoms of the harsh cough, shortness of breath, or fever to help prevent the spread of the disease.
Thank you, Shannon. Next, we'll have Dr. Dan Reifenberger with Brown Clinic.
I'm going to spend a few minutes just discussing the testing, because that is the part that has been changing and evolving rapidly, even compared to what was recommended as of yesterday, to this morning, to this afternoon, is again continuously changed. So at this point, what the criteria are that we have to decide when somebody needs to be tested is if they are in a high-risk category. That would include having a cough, being short of breath, having a fever, which would be defined as greater than 100.4. If they have any known exposure to someone who has had a positive test, travel outside of the country in particular, but even certain areas within the country, and again, that keeps evolving as far as with it. And then to also be where you are high risk if you are an inpatient in the hospital, if you are a resident in communal living, long-term care facility, assisted living, or if you are a healthcare worker in direct contact with these patients. Before we were able to do if they had moderate risk, but now everything is at high risk in those categories with it. Now, part of this task force that we're working on is trying to be unified with everything else as far as what we would have for recommendations, how we're going to take care of these patients when they come in. So we're all trying to be consistent on things with it. The clinics are evolving different ways of how we're going to triage these patients, whether phone call or telehealth, telephone conferences, which is being changed as we speak. It's evolving that fast as far as how we can try to do that to still try to take care of patients without having them to come into the clinic. Because truly, if you are sick, first thing is stay home. If you have any questions and your symptoms are progressing, contact us and we'll help walk you through to help decide what that next step should otherwise be. And again, this is continuously evolving daily.
Thanks, Dr. Dan. Are there any questions from the media here?
Troy Van Dusen, KXLG Radio. Do we have a number of cases that are pending in Cottington County that have been submitted to the health lab here? Do we know what that number would be?
So we looked into those numbers, and that number is constantly changing, as everything is evolving. But the important part is, if you are sick, to stay home. And we are submitting tests to the Department of Health according to those guidelines of high-risk patients. Yep.
Question for Sarah, if you wouldn't mind coming up.
Sure.
I know that you mentioned in your comments that you want to remain as close to business as usual as possible. How do you balance that with some of these recommendations that are coming down on limiting gatherings and social distancing? How do you find that happy medium, I guess?
How do we find the happy medium with providing with the guidelines of the CDC of social distancing?
But keeping businesses.
And keeping business
yes.
as usual, yes. We actually, it's not as hard as it seems. We are successfully able to do that. A lot of people ask about the Prairie Lakes Wellness Center. It is possible to go there and be far apart from other people. And our staff are monitoring that. They're wiping everything down constantly. So we still have business as usual in a sense. We've canceled all the classes, so those aren't going on, but people can still use the wellness center. At City Hall, for instance, we have seen the public step back, and so we haven't had to close our doors. The public is hardly coming in at all. And when they do, they're coming in one or two at a time. And so we haven't had to do anything different other than we're just trying to maintain a good social distance and keep the hygiene going. So far, it hasn't been really hard. People are self-regulating and taking care of that on their own. So appreciate the question.
If you have city employees that, well, given the current conditions, do they need to request permission to work from home remotely, or can they
Yes.
just automatically do that on their own, or do they need department head approval?
Yes, city employees, some are allowed to work from home if they have a job that can be done at home. They have to get their department head's approval, and then we have to set up the procedures for doing that. But we do have some people already taking advantage of that. So that is available to the city employees. It hasn't shut business down. For instance, our building official is still working and processing building permits from home. And we take the customers in City Hall and we can email to him. So if you need a building permit as of today, we are still providing that function. Obviously, police, fire, sewer, water, garbage, gas and electric, all of those things are continuing absolutely normal. There's nothing affecting that. So we still are for the most part, able to do everything business as usual. Thank you.
Any other
This
questions?
question would be for Jennifer. Prairie Lakes, the visitation policy up there hasn't changed over the last few days, still the same?
It is still the same. Yep, if there are any updates, we will let you know
Can you tell us what that is?
what the policy is. So currently, the Prairie Lakes implemented a visitor policy last Friday. So the visitor policy is 1 visitor per patient. So, it's really to protect both our patients and our staff during this time.
Can I ask one more of Sarah, please? And I was gonna ask it before you stepped away there, I'm sorry. There have been some private businesses in town that have elected to shut down temporarily. Are you getting any calls from private business owners seeking guidance on what they should do? Or are you just letting them make their decisions and just kind of staying out of their business more or less?
Right, private businesses are taking it upon themselves. We've had a few calls about what should they be doing, and our advice is to follow the recommended procedures by the Center for Disease Control. So for a community like ours that hasn't had any positive cases, it's all that housekeeping, good hygiene, social distancing. If you can do your business while maintaining that, it's perfectly fine to just go business as usual. But most places are taking precautions, and some of the restaurants you've seen have closed down and maybe just have delivery or drive-through. And that we haven't required that as a community. People are doing that on their own.
Any other questions?
And one question for Nick, please, if I could ask you a question, Nick, since you're the police representative up there.
Yes.
There are some police departments that are changing policy and they're not stopping people and issuing citations for certain, I'll call them minor offenses, because they want to limit contact between officers and the public. I know Sioux Falls has taken that step. Is Watertown doing any of that? Have you changed your policies at all? And maybe what is the police department doing to protect your officers, since you're frontline people?
Oh, good question. Yeah, if you're asking for permission or that you're able to speed, Mike, you do not have permission to do that.
Don't insinuate that.
No, it's a good question. For the police department, we look at these types of cases, and we do want to limit any exposure. But we are still enforcing city and state laws. We will make a traffic stop if need be. We are asking our officers to use discretion, but we're also asking the public to be on their best behavior also, meaning practice that social distancing. Don't go anywhere that you don't need to go. We've already seen traffic be limited throughout the city, and so we appreciate that. The nice thing about being in South Dakota, and I saw this on Facebook, is we've been practicing social distancing since 1889. And I think that's something to say about why we live here in our community, is that we can get through these tough times together. And that's a good question, I appreciate that, but we're still enforcing city and state laws, so thank you. Are there any other questions at all? Okay, be looking forward to these briefings each afternoon, and we appreciate the media spreading the word and helping us get out all the information that we need to make sure we're all staying healthy and safe. So with that, we'll end it. Thank you.
Is there gonna be a set time daily?
3